Hi, this is Dr. Hassan from CPRM Clinic. Today's topic is vertigo. Vertigo is a condition where we feel that everything is moving around of us. Everything is spinning around of us. So why this thing is happening? That is very important things to know. What happened actually, in our inner ear, there is a semicircular canal. And in this canal, sometimes it could be inflammatory, interrupt the function of the balance system, or sometimes there is a excessive pressure of the semicircular canal. These all reasons results the vertigo. So what are the types of vertigo? Vertigo is two types. One is the peripheral vertigo and one is the central vertigo. In peripheral vertigo, there are three types of vertigo there. One is the Bppv, benign post-paroxysmal positional vertigo. The second one is the Meniere's disease. Then the third one is the acute vestibular neuronitis or labyrinthitis. What is Bppv? In Bppv, the crystal of calcium carbonate, which is called the autoconia, displaced in the semicircular canal. They may be displaced by the viral infection or by the head trauma, by aging, or it could be that without any reason, the idiopathic. The crystal disrupts the function of the balance system. The balance information cannot be reached up to the thalamus, and whatever we see that everything is moving. This lasts for around 1 to 2 minutes. It's a very short period of time, but it can last up to hours also, and sometimes it can continue for several weeks. Now the second thing is coming, which is the Meniere's disease. Meniere's disease is a condition where the pressure increase in the semicircular canal results the hearing loss, tinnitus, vertigo and fullness in the ear. It's basically a problem with the middle-aged group people, and this is not a positional condition. And the last one is the acute vestibular neuronitis or labyrinthitis. This is the basically inflammation in the vestibular. Now it's coming the central vertigo. What is central vertigo? Central vertigo is a condition when there is a brain involved. Brain involved in the sense like in stroke or in brain tumor, or sometimes like the vestibular migraine, syphilis. These all conditions the patient will feel some kind of dizziness. This is called the central vertigo. And one more thing I should discuss, that sometimes in my chamber I have seen that many patient comes with vertigo. It's not the vertigo, it's actually the dizziness due to the reversal of cervical lordosis. Basically, there is no relation between the cervical spondylosis or the reversal with the vertigo. But I have seen some cases where the patient complains that there is a very shortness of vertigo because of the reversal of cervical lordosis. What happened actually in reversal of cervical lordosis? The patient feels that 3 times or 4 times more heavier than the normal head weight. The neck does not have that much of control over the head, and it feels much more than normal head weight. So that is the reason sometimes the patient may have feel some kind of vertigo, and it's easily goes off by giving ultrasound therapy for a short period of time, like 10 to 15 days. Now what are the exercises we can go for? The first one is the Brandorf exercise. The second one is the Semont Maneuver. The next is the Foster's Maneuver, and the last one is the Bppv Maneuver. These all exercises I will demonstrate. Please follow this video. We will show the exercise of Bppv, benign post-paroxysmal positional vertigo. The model is sitting over here. I will demonstrate all the exercise today. The first one is the Brandorf exercise. Brandorf exercise, the patient will be sitting outside the couch with the leg hanging position, and he has to tilt his head any one side, right or left. Tilt your head to the left, yes, around 45 degrees. Then the patient will lie down the opposite side. Yes, Patient has to hold around 60 seconds until the dizziness goes off. Once the dizziness will go off, the patient will come back to the normal position with the tilting head condition. Okay, come back to the normal position. Yes, and the neutral head position. Okay, the same thing he will repeat on the opposite side. Tilting head right, 45 degree, lie down. Yes, until the dizziness goes off. He has to wait around 60 seconds, then come back to the normal position with the tilting head position. Yes, and then neutral head position. Fine. This is the Brandorf exercise. The next exercise is Semont Maneuver. Semont Maneuver, the patient will be sitting in the previous position with the head tilted to the left and lie down on the right, lie down on the opposite side. Yes, here also you have to wait around 30 to 40 seconds until the dizziness goes off, and then come back to the normal and just lie down to the opposite side with the same head tilting position. Opposite lie down, instant, and look down to the couch. Here also you have to wait around 45 to 60 seconds until the dizziness goes off. Once the dizziness goes off, the patient has to come to the normal position. Come to the normal position. Yes, the head in neutral position. This is the Semont Maneuver. The next is the Foster's Maneuver. The patient has to come on kneeling position. In kneeling position, he has to look direct upward on the roof. In this position, the patient may have feel some kind of dizziness, and he has to wait until the dizziness goes off around 60 seconds. Then directly the forehead on the floor. Yes, head tilted to 45 degree. Yes, here also the patient has to wait around 30 seconds and then come on the quadruped position, head tilted position, head will be in the same position, then go back and neutral head position. This is the Foster's Maneuver. And the last one is the Bppv maneuver. The patient lie down in supine position. This is the Bppv maneuver. In Bppv maneuver, patient will be sitting on the couch and then he will be lying on the supine position. One pillow should be kept under the neck, and then the head will be tilted to the left around 45 degree. We have to wait around 45 seconds to 60 seconds until the nystagmus or the dizziness goes off. After 1 minute, the patient will look to the opposite side. And here also you have to wait around 60 seconds until the dizziness goes off. Once the nystagmus is off, then he will go for the sideline on this side with this same neck position and wait for around 1 minute and then sit. Okay, held tilted position, then come back to the neutral position. Yes, this is the Bppv maneuver. And the last one, everybody knows that this exercise is called the vestibular stimulation exercise. The patient's one finger should be around 1 feet away from his eyes, and the finger will be on the up, down, left and right. The only eyeball will follow the finger. No head movement will be taken. No head movement will be taken. Yes. Okay. The next one is the finger will be fixed and the head will be moving. Right and left. This is called the vestibular stimulation exercise. Okay, thank you very much. Stop. Today I have shown that 4 exercises for Bppv. The first one was Brandorf exercise, the second was Semont exercise, the third was Foster's maneuver, and the fourth was Apple's maneuver. All these exercises patients should do twice daily, and the repetition will be around 2 to 3 times. If the patient will be having severe vertigo, then the Foster and Semont exercise should be avoided until the dizziness is less severe. If it is more severe, then the patient should stop these 2 exercises. The Brandorf exercise and the Apple's the patient can go for from the very beginning day, and the vestibular stimulation exercise also the patient can go for from the very first day. Thank you very much. Thank you. Don't forget to subscribe my channel and press the bell icon.